always a pleasure to come speak at this, what really is the centerpiece course that the Department of Medicine at UCSF puts on each and every year. So thanks to all you brave souls who had a break, got your food, and rather than running away before the rheumatology section, came back down and sat down to spend the rest of the afternoon with me. So I promise I'll reward you with information you probably didn't know, even about a disease like gout. How many of you treat gout in your practice? Everybody. I chose a relevant topic. Great. So let's get started. Gout, as you probably may know, has a pretty prominent place in world history. Most recently, David Wells was pitching for the New York Yankees, pitched a perfect game, and went out afterwards, and as you can tell by his body habitus, celebrated a little too hard and suffered a significant gout attack that placed him on the disabled list after his remarkable feat. But if you go back to the founding of our country, Benjamin Franklin was a notable sufferer from gout. Those of you who ever saw the musical 1776 know that he was not present at the time of the signing, I believe, of the Declaration of Independence, because he was apparently, according to the musical, having a gout flare at the time. King Henry VIII was noted to suffer from gout. It was also noted to have a pretty bad temper, and whether the two coincided or not and resulted in a few extra beheadings or not is unknown. But he certainly was a known sufferer from gout. But you can go back even farther than that. Hippocrates wrote about gout. He said, persons affected with gout who are aged, who have tophi in their joints, who have led a hard life, and whose bowels are constipated, are beyond the power of medicine to cure. Luckily, we've come a long way since Hippocrates, but this also tells us something. Gout is an ancient disease. Rheumatoid arthritis, that I'm going to speak about in a little bit, is not an ancient disease. It's a disease really of the last couple hundred years. But gout, you can go back into antiquity. In fact, you can go back into pre-antiquity, to the time of the dinosaurs, to find evidence of gout. Tyrannosaurus rex, if you look at the fossils closely enough, has erosions in her bones, especially in her metatarsals, that look an awful lot like gouty erosions. And this was written up in, I believe, an article in Science, and then published by the New York Times as well. So why give an update on gout to all of you? Well, all you guys see a lot of gout in your practice. That's because gout is very prevalent. It affects about 6% of men in the United States, over 6 million of them. Yes, over 6 million. About 4% overall of the US population. About 2% of women are affected, because really we don't see gout in women until they're in a postmenopausal state. The prevalence of gout has increased by 1.2 absolute percentage points over the past 2 decades. That's an increase overall of 30%, if you think about that. Crystalline arthritis, in general, accounts for about over 2% of all hospital admissions, about 40 million admissions to the hospital a year. So it's a costly thing, both in the inpatient setting for you hospitalists and in the outpatient setting as well. It's responsible for 5% of all outpatient visits as the primary ICD, at this point, ICD-9 diagnosis at the time the study was done. About 5 million visits are coded primarily for gout. It's an expensive and very morbid disease. So a question for you guys is, in 2002, what percentage of outpatient visits specifically for gout were to rheumatologists? Were A, 1.3%, B, 13%, C, 33%, D, a little over half, or E, about 3/4 of all visits? How many do we rheumatologists see? And the answer is, most said B. The answer actually is A, 1%. So almost 99% of all the visits for gout in the US are seen by you guys, actually, not by me. I see some of the very bad ones and the difficult to treat ones, but you guys are on the front lines of this, which is why I want to speak about this today. Gout is primarily treated by you guys. 70% of all patients with gout are under the care of primary care physicians of one kind or another, and only about 3% of all gout patients as a collective are ever referred by their primary care physicians to rheumatologic care, probably because they're the more difficult to treat cases, obviously. Why else give an update? Well, gout is generally mismanaged, and I'll show you how in a second. There's an underuse of uric acid lowering therapy in patients who are likely to benefit from it. There's particularly an underdosing of allopurinol in patients who are on the drug. Just to give you what that means, 40% of patients who have a serum uric acid that's out of the range of where we target it to be are maintained on their current dose of allopurinol, don't have their dose adjusted or switched to another medicine. And as we'll talk about in a second, there's an initial overdosing of allopurinol as well, particularly in patients who are at risk for hypersensitivity. So, and the last reason why I really wanted to give an update today on gout is there's a plethora of medicines that have come to the market recently, and I'll talk a little bit about these during the course of my talk. There's some other medicines that have come to market that are pretty good medicines that are actually coming off the market as well because they're not selling very well. But the therapy realm for gout is actually in a lot of flux, and I'll talk a little bit about that in my talk today.